when the Corona crisis started and it became visible, for me, it was the point of decision was March 11th. So, and I was watching the whole development, and I was watching the treatment about that whole topic in different governments, in different decision areas, in companies, and so on. And my feeling was, with the 13 years of design thinking perspective and history, that we always try to solve complex problems with a complex setting, which means if there is a complex challenge given to us by companies, by organizations, we always put together a team with different disciplines, with different perspectives. What I saw as a solution process in the organizations, we could point on the German government, for example, they were just focusing on one specific expertise, which were the medical people, the people who are the virologists, the experts, one group of experts. And I had the feeling from the very beginning, this is not the right mode. We should move. We should move in this kind of high complexity, where social aspects, statistical aspects, political decision making, and lots of different things. We should have started immediately with a complex setting in a kind of design thinking mode. So my first question goes probably to not even to Martin, but actually to Klaus, because you are running that network, which is a highly diverse network. And just by accident, the two companies who actually did the app, like Telecom and SAP, are part of that network. Did you think of that? Did you have a similar feeling? And I just want to learn from all three of you. What is your feeling at the beginning, and did we treat that right?
Yeah, you're absolutely right that the focus was more on virologists and medical people when the crisis started. But I think later on there were always hackathons and other approaches that led to different viewpoints. And yes, definitely the healthcare puzzle would have been a good melting pot. But at that time we were in the shutdown and didn't have the opportunity to bring the people together. So I think that's a great learning, because this might not be the last crisis we have in this healthcare system, and there are a lot of challenges around anyhow, and therefore I think it's absolutely important to point out that you should not look at only one expertise, for example, like virology, but also bring in people from other, being it technical, being it social organizations, because they have different viewpoints on the same challenge, and that always makes a difference. And that's from the background of the healthcare puzzle network, I can say yes, it makes sense to bring a different people from different organizations together, even if they don't understand anything from virology. They do have, for example, a different technical expertise that they can bring in.
Yeah. Thank you very much. Martin Fassunge, how do you see that? Do you have a statement to that as well?
I see this a little bit different, because what is new for SAP is that we're stepping in, building a solution or building an app in this area. You have to be directly involved as well in politics, and as well you can learn a lot about pandemics, not about virology, but about pandemics. You have to be fit, and there is a good article today in the Zeit, German weekly newspaper, number 34, of Boris Palmer, who is the head of a German town in Tübingen. It's in the Green Party, and he responds to the article of the virolog Drosten from last week in the Zeit, and you have to read this, because why do I say? In Germany, Germans are, always tend not to be understanding how good it is in Germany. And I think the phase 1 of the corona epidemiology in Germany, we have tackled very, very successful. And unfortunately, we are, I would say, if you look on the figures, on the numbers and how it runs, we are again on the way to run into March. Why do I say this? You know, to be honest, the situation in March exploded due to the fact that you have had vacation in Ischgl, and this was the thing which spread it, which really was, so to say, the entry point for the pandemic in Germany. And we obviously are facing the problem in the politics and so on, that you need to deal with this pandemic a little bit discipline. You need these rules of distance, you need these rules of hygienic, and you need to have these rules that you are fast in infection methods. And this is what Mr. Palmer writes today. If you would, for example, use the app more as of today, and this has no disadvantage for you, and if we would be able to connect the laboratories that you can get the test results very fast, then you would have a chance to be much, much faster and much more efficient to get a second lockdown out of the way. And I think we have to be clear about this, only due to the fact that we have now August, and the situation with the virus itself and with the pandemic has not changed in comparison to March. And learning effects, I say this as well, this has different aspects. This has social aspects, this has discipline aspects. But I think we have to think about, you know, at the beginning there was the problem, don't use masks, which is obviously wrong. Don't use distance, which is obviously wrong. And this we have to carefully check. On the other hand side, you can be really in fear that you will see a second lockdown, and then you are always in the question, like in Swedish, for example, do you protect the economy or do you protect the lives? And I think in our society, normally the protection of life is very important. If you carefully look in the high numbers of deaths we have unfortunately had in Germany, it was always in retirement in hospitals. And there I think you need to protect the inhabitants better, because these are as well the risk patients. So I think we have to come back and we have to learn this. And I would recommend for everybody to have a look how to deal with pandemics, that you better understand the system, how it works. And we will reach out to Boris Palmer in Tübingen, and we have to look why it is not possible to get the usage of the app about 20%. I think you need there as well local installation team in quarters. I think the question was not raised here in the panel. Why is Apple and Google delivering the app first for cell phones running on an iOS 13.5? And I checked this as well. The easy answer is, if you wanna buy it for your parents, for example, the cheapest thing in Android costs you 70 euros. And my parents have had as well cell phones 8 years old. I for sure have interchanged them. I think that is not the right question we are dealing with. The question is, how can you push the usage much more higher, that you understand that if we have this lack of discipline, we are running again in a very critical situation. And the question of pushing it higher, that's a question I think where we should use, Uli, the things you and Klaus mentioned, that we sit together and figure this out. You need quartier managers. You can see this. We have high numbers in the usage of iOS. We have less numbers in the usage of Android. One answer is that this pandemic has for sure a socio-economic factor, that the guys who pay more for the cell phones are as well the guys who are better understand this, but we have to reach as well the guys who have no chance to install it by yourself alone. So I can tell you, my parents, as I said, 75 and 79, were not able to install it alone for whatever reasons. And if you want to push the usage, you have to go in the quartiers and you have to spread the tools. I think that is the interesting aspect. We have not to think about the methods, but we have to think about how do we motivate for the methods.
Yeah, I think looking at the time, since you have to leave to the other meeting with the healthcare ministry, thank you very much. I think you are actually calling the new healthcare puzzle for more action, isn't that right? Let's really think of that, and let's get together. Let's continue that discussion also in a larger round. And I think it's also, you are also calling for getting politics involved. So that was one of the questions from the audience. And I think we should, in our next round, pretty sure that that should become a topic, and the next round is coming.
Uli, this would be interesting when you can can coordinate, or when you can organize as well a fast follow-up in Berlin. You know, there are areas like Neukölln and so on where we have to figure out how to reach in pandemic the situation here. And that's interesting how to do with practical organizers, with social researchers and so on. How do we do?
Low threshold. Yeah,
low threshold, all these things. And you have to do, because you know as well, until you get a vaccine, it will take, if it is really fast, until May next year. So until May next year, we have to work with the methods.
Yeah. And for example, why not get help, for example, in a pharmacy, if somebody who is not able to install something, to get support there, but that's something you have to incentivize and where you have to put in some efforts behind, so that people can be helped, for example, for installation of an app and how to deal with it, for example, or other institutions that have low threshold and where you can reach easily in your community.
Yeah, exactly. And these are the things, I think, in my point of view, which we can deal very good with the methods of design thinking and bringing different people together to understand.
Yeah.
And then you do not need an ideation phase what you have to do, then you need an ideation phase how do you take the measures which are obvious.
Yeah.
Really, thanks for inviting me and for hosting us, and sorry that we have to, or I have to leave earlier. It was very interesting stuff from Peter and from Klaus, and hope we do the follow-up.
Yeah, thank you very much, and send greetings to the ministry and tell them that there is a new healthcare puzzle. You know,
I will tell. Perfect. See you.
Bye. Thank you, Martin.
Bye.
So, and then now we got some time also for Peter. I'm sorry to leave you a little bit alone here.
No, that's fine.
I just wanted to use the time for Martin.
Yeah, of course.
But Peter, you are very close to the local areas, so you have a certain view on that probably as well.
Yeah, I think, and I can't say that our team and our partners, the Commons Project, were so brilliant that we designed and saw things in advance that made it perfect. I think we were lucky that we have a very diverse team. I think there was some forward planning in getting different people together, and we definitely benefited from having that. Particularly the locations that we're working in, you have to have local voice and local engagement. It cannot be a top-down solution. It just simply, it won't work and it won't sustain. But that we need diversity because the challenges we have are significant. So for example, in East Africa, smartphone penetration is less than 30%. And of that 30%, 70% is Android and 30% is iOS. And for sure, the people with iOS are the elite in society in those locations. And most people are still using what we call the feature phone or the flip phone, which has a non-graphical interface and requires multiple button pushes. So from a design consideration, very, very different. How do you get feedback from a feature phone? And can you use IVR systems, so interactive voice response systems, to be able to answer a question by saying 1 or 2, which is very much how many other things are done in terms of surveys and collecting data. And there is a whole different process of how you design interactive voice response, the local dialects that you have to use, how you phrase the questions so that you don't influence unduly the statistical nature and validity of the data that you're gathering back, etc. And so it was a challenge for us in the East African community for sure. And even in the favelas, you know, the penetration of smartphones is higher in Brazil and in Rio, even in the favelas. The biggest problem there, probably one you don't face so much in Europe and Germany or in the US, is there's a high price sensitivity around data. And so people are really sensitive to anything that creates a data charge for them. And we didn't have time to work with the mobile companies to make this a free data app in terms of any data usage. So you have to build and design a system that is also really, really low on bandwidth consumption and data charge fees. And in fact, what a lot of the people that are working with the application now in favelas, they actually don't use cell for the data. We had to design it so that it could queue the data. They go to a Wi-Fi hotspot, and then they upload everything at once just to avoid a cell data charge. So if you don't have the local community telling you from the beginning, this is a design issue, this is a real, if you really want to get adoption, you have to have this, this, and this. You sitting sort of in a more comfortable environment, you might not put that at the forefront of how you design for the application. And so I think it's absolutely essential that you have that. The second piece we also have as a partner is an organization called Future State, and they brought specialists in that helped us use different ethical data canvases. So the Open Data Institute in London has an ethical data canvas that they deploy. I mentioned Ethical Explorer is another. Ethicalexplorer.org is a new tool set that has come out for software application to really consider design implications for how data is structured and collected. And in the case of the favelas, it's a very real security concern. You have to make sure that the data you collect and how you collect it and where it's stored meets, first of all, Brazilian regulations. Because if you collect data about Brazilian nationals, by law, it has to be stored in Brazil. It can't leave Brazil, number one. Number two is that you might not always have a government that is acting in the best interests of the people and is looking to surveil people for other purposes beyond public health. And so you have to be so careful that the data that you collect and present cannot be disassembled that in a way that can personally identify groups or individuals of people because of security concerns. And so having people on the team that walked us through sort of a 9-panel step of why are we collecting this data? Is this data absolutely necessary? Where will the data be? Where will it move on infrastructure? How long will it be stored? Can it be accessed illegally or through hacking processes? So, without all of these different diverse groups on the team, we would probably make a lot of mistakes. And I'm sure we've made some mistakes, but we would probably make a lot more. And they could be, the impact of making those mistakes could be significant in some of the communities and geographies in which we work and support.
Thank you, Peter. I was just scanning there are some questions. There's one question already from half an hour ago or so to Klaus from Sandra Ellen. Within the healthcare puzzle network, how do you measure the readiness of public policy regulation for the implementation of a solution?
Interesting question. Yeah, I think it's always important to start with the needs if you develop something, and if there's a certain public need or political need that can be important, but from my perspective, most important is whether there's a need from the patient or a need from the healthcare system, and then comes the politics in the third instance, I would say. But you're absolutely right. If there's some political support, that's always helping. And always supporting the efforts to develop some new solutions. And And for the time being in Germany, we are happy to have a political environment that is heavily supporting, for example, digital tools in the healthcare system. And it's more important to overcome hurdles in the system because there is a lot of political support, but the regulations around data security, which are absolutely important and are sometimes so difficult that you have to work on this for a certain period of time. And so yes, absolutely necessary to have support here, and hopefully I understood the question right and got it.
Yeah, that maybe adds to, or there's another question from Christiane Weinreich. And I think it also points to you, Klaus. If you try to get in touch with politicians, did you propose your idea about using design thinking in the Corona decision process to politicians? That might be a question to myself. Also,
yeah,
also
absolutely. That points directly to you. But I'm in fond of supporting this idea because I think it broadens the viewpoints and the minds of the people working on such a complex question. So heavily support this.
Yeah. Yeah, I think actually the healthcare puzzle is a highly interesting open organization which we could think of using that more for addressing politicians.
Yeah.
So there's another interesting question from Gordian Overschmidt. He was asking, what about thinking bottom up instead of top down? It is all about the competence to decide to take responsibility for oneself and other change of perspective. So he's pointing on, why do we always think of the big solution? Why don't we think the other way around? How do you think about that, Peter? What?
Yeah, I mean, it's a good question. I think the reality is, especially for many of the places that we work, is first a lack of understanding of what is possible. And so while the capacity is innate, sometimes you have to activate the capacity and interest locally to understand how and why they can organize or get active as an individual and try and create the solution. So I think there's always a role for both a central exchange or hub that is sensitive and connected to local bottoms-up approaches. But I think a bottom-up approach only gets so far and has trouble with scaling and sustainability. And just as there are problems from the top down, which is often hammers looking for nails, because the top always thinks they have the solution and then they go looking for the problems. I think the answer is you need both. And it's how you work in harmony with both and be responsive to each, where you get, my experience has shown that's where you get the best success.
Klaus, do you have thoughts?
Yeah, I fully agree. I think you have to come from the needs, but on the other hand, you have to know what's possible. And that's always, and bringing this together, that makes the difference later on.
So I would love to learn a little bit more from you, Peter, about your next steps. You were talking about Brazil, you're in the favelas, you are in Eastern Africa. What are your that looks like, okay, you got addressed by those by organizations or governments. What are you seeing next for your activities, and what will be your wishes?
Yeah, we continue to evolve some of our thinking around what Place Fund will be, and I think that one of the areas that we're focusing on is the lack of good fundamental data in so many of the places that we look to work, particularly say Africa or even Latin America and the Caribbean. And, you know, in Germany, for example, and I had spent a little bit of time doing some work with a partner in Germany, you have the benefit of really well-functioning organizations that provide very detailed, very high-quality data about the world around you, the place that you live in. So whether it's ADKIS type data that maps everything in sight and maps underground utilities and roads and places and names and land use, and even the Grundbook, which is keeping all of your records about ownership and change and so forth. These things function so well in planning and permitting. There's fantastic databases around about the place around you in Germany. And I think this is a huge challenge in so many other economies. And what's really happening is, as those governments struggle to provide even the basic information, they really don't understand much about the population they have, the dynamics and nature of the population, where the population is, the lack of services being provided, and the changing nature of land use all the time. And as time goes along, this separation is getting higher and higher. And what happens in the absence, in that vacuum created by the public institutions not being able to keep up with all of this information, the private platforms begin to produce the data, like Facebook and Google. And we think that that's probably challenging, because then the private platform, which is really answerable to shareholders in pursuit of profit, nothing wrong with that, but essentially you're having a failed public good being serviced by a private platform because it has the power and scale to leverage the platform to deliver that failed public good. And it's not transparent and open in terms of the data that it continues to build and maintain. And we see a need to create what's now being called a data trust, a way of collecting the data in the absence of the public institutions, but that still has a public good design and openness and transparency and governance system. So I think as this year goes on, we will be looking to come out with the new approach with our partners and our new governance structure around building a sustainable model to create and build information about the place around us and making that available as a public good, but in a sustainable way. So that's the vision and goal of the Place Fund. And we see an ability to ourselves leverage and raise financing that goes to local organizations, be they commercial or nonprofit, to collect and be members of this data trust, and to pay them for the work that they do collecting this very important information. So we'll see how it goes, but that's the plan and the idea, and it's gaining a lot of very interesting partners, one of which, of course, is the government. And it is essential that government be a partner in a process like this. And I would say in anything that we're doing, and Klaus, I think it's the same for you in your puzzle network. The government has to be a good partner and a willing partner, because it has the ability to leverage things at a scale and movement that only the government can do. And let's face it, in the response to the pandemic, ultimately it's only the government can truly move in the way that you need at scale and speed. And so I think to solve these big problems, government has to be a good partner. And that can be a challenge in many of the places that we work, because not always is government the best of actors. And so we have to bear that in mind as well as part of our partnership.
Yeah.
Yeah.
Yeah, even if I'm not a representative of a government, what I would think is that also Global Design Thinking Alliance could be a partner for your activities, and we could discuss that later, that what kind of role the GDTA plays, because you are in an agile mindset working anyway. There might be opportunities for our 16 partners, and which could help you also to find and address other people and to start a research on and solution process over there.
Would happy to discuss that, Uli. Sorry for jumping in. And I think to stress something I've mentioned several times, no one can do this alone. It's absolutely essential to have partnerships here. Just so we're completely agree and open. So look forward to the discussion.
Very good. So I'm just looking. Oh, there is there's Sebastian Schulz. Right now is reacting on that. Since my partner works in Tanzania as epidemiologist on tuberculosis, I also have a question on the tool for the EAC that you just presented. You said it's open source and further use within East Africa might be discussed later. Do you think this tool might also be adapted and used for tuberculosis cases, representing once the corona pandemic is under control? What is your impression about government buy-in concerning this topic? You talked about the last point already, but the first part of the question, Peter.
Yeah, I mean, and I would be happy to be connected. I'll be careful because I'm not an epidemiologist or public health specialist. So in theory, from a technology standpoint, the logic is also open with the COVID check. And I would think that with adjustments to the logic specific for TB, that the same technology absolutely could be leveraged and the same infrastructure could be leveraged for sure. But as I say, I would just caution that with saying that probably the medical professionals should check that because there would probably be changes to logic specific to TB. But from an infrastructure and technology standpoint, I see no reason why it absolutely couldn't be reused.
Okay. So we are moving towards the end of the 2-hour session, and I would not really fit it completely to the end because I have to announce also what is going on in the next hour. But I would like to give Klaus also the talk. I was asking Peter about his ideas and wishes. Same for you.
Yeah.
You have some wishes for, especially for the new healthcare puzzle.
Yeah.
I'm also.
Yeah, I think the COVID-19 crisis was, if it had one positive aspect, that was the support of the heavy support of digitalization in the healthcare system all over the world, I would say, being it telemedicine approaches or being it approaches for self-control and organizations and so on. So I think there is a big push that is going through the healthcare systems all over the place, and especially in Germany. And I would hope that this push goes into the right direction, and we are able to support with this diverse group of companies to support the digitalization push into the healthcare system in Germany. And yeah, this could be a next step for our group to bring in our competencies, our diverse competencies, and join forces with, for example, politics or politicians in this field. Thank you.
Thank you very much. Yeah, thanks to both of you, Peter, Rabley, for first getting up so early and then sharing your highly interesting work activities, and also to Klaus Suwelack joining from Munich.